We all know healthcare is expensive, but for the millions of Americans who purchase their own health insurance through an ACA marketplace, it's about to become so unaffordable that people might forgo coverage altogether. The ACA, or the Affordable Care Act, which you might know as Obamacare, created an online platform for Americans to shop, compare, and enroll in health insurance. These marketplaces allow Americans to buy their own health insurance, especially if they lack employer-sponsored health insurance or don't qualify for Medicare or Medicaid.
These are farmers, these are hairdressers, these are entrepreneurs and gig workers across the state. For an older couple, say 55-year-old couple living in Sacramento who make $85,000 a year, they would see their monthly premiums go from about $600 a month to over $2,000 a month. That means that they're going to have to come up with almost $20,000 more over the course of the year to just maintain their coverage. At 55, we all want to be healthy, but many folks have chronic medical issues that they're struggling with and need to be able to have affordable coverage. That couple has to make an impossible decision right now. Do they continue or not?
That's Dr. Monica Soni, the Chief Medical Officer of Covered California, the state's ACA marketplace, talking about the kinds of people who will not be able to afford health insurance unless Congress takes action to extend the subsidies and keep coverage affordable. The uncertainty is already having ripple effects. Of the 2 million people that get their coverage through Covered California, 100,000 of them have already canceled their health insurance.
Many have shifted from a richer plan that has more generous benefits to a bronze. That's more of a, kind of a bare bone plan where you're paying much higher amounts and deductibles. You're sort of crossing your fingers and hoping you don't have a medical emergency. You're avoiding going to the doctor.
Megan Hansen, a licensed family and marriage therapist, is one of those Americans.
It's only really the first time since we were able to get these enhanced subsidies that I felt like, oh, I'm finally comfortable buying decent health care. I've worked in the nonprofit world for like over 15 or 16 years, very low income. Becoming a therapist in the last decade gave me more income, and I thought, oh, I can do this now. But without the subsidies, I might not even get coverage this year. I might roll the dice, take the risk, except that in California, of course, aside from what was the federal penalty we now get a state penalty, and it's significant if we don't have health insurance. So I want to get health insurance if it helps other people get health insurance, but I'm at the point where I'm just like, geez, like, how is this going to work?
With a brutal flu season approaching, and millions of Americans poised to lose their health insurance, the results may be catastrophic for patients and health systems alike. Hospitals could see a rapid increase in hospitalizations from vaccine-preventable illnesses like the flu. Patients will be hit with massive bills for this care as they recover from their illnesses. Dr. Tasha Dixon, a family medicine physician in Texas, is concerned.
It's my worst nightmare, actually. So when we think about what this ripple effect is going to look like, we're thinking about right now where the state of health is not, for the average human, it's not where it should be. We were already trying to really make strides in what healthy looked like for the average American, for the average Californian, for the average Floridian, for the average Texan. We were already working on that. Now you put in front where you're stressed for bills, you're stressed for everything else. We're looking at the idea of, do I stop paying for my insurance and then end up in the emergency room? Let's talk about what that looks like when we get to the emergency room now. Do I afford my medications when I get out of the emergency room? Can I afford to take those medications and not go to work? Did I miss those days from work? Do I lose my job? It really does affect the social determinants of health in terms of thinking through the entire picture. And I think as healthcare providers, so many times we just think of them seeing us right there in that moment. We don't think the fact that they're in front of us, they may have just lost their job and they can't pay for their premiums next month.
Dr. Jared Bowden, a family medicine physician and Butte County Public Health Officer in rural California, urges Americans to take prevention seriously.
I promise you, every county in this country needs to start focusing on the low-cost prevention options. If you have not gotten a flu vaccine in the past 10 years and you're about to lose insurance, this is the year to get your flu shot. And so we're trying to encourage that as a public health department. We're trying to go out, have more opportunities for people to get vaccinated. And we're starting to think into the future of can we provide these services when people don't have health insurance?
As you consider whether to keep your coverage in 2026, please remember that prevention is key. Get your flu shot, protect yourself, and look after your loved ones.